For a conversation about living with cancer, please welcome Ruth Browne, the President and CEO of the Ronald McDonald House, New York, Razdan, the CEO and co-founder of Care+Wear, and Brenda Nevidjon, CEO of the Oncology Nursing Society, here with Michael Smith, Chief Medical Director of WebMD.
Hi, everyone. Thanks for attending. I'm telling you, I'm so excited to talk to the panelists today because these are the experts who are directly caring for patients and their families. So, Brenda, I'd like to start with you. As a recognized leader in oncology nursing, both in the clinical and non-clinical setting, can you help our audience really understand how it's a special and really specialized field of nursing compared to other fields?
Well, thank you, and good morning, everyone. Oncology nursing became really an identified specialty in the 70s, but nurses have cared for people with cancer forever, as you can imagine. And of the 3.4 million nurses in this country, I would venture to say almost everyone has been touched by cancer somehow, whether it's in their professional life or their personal life. But for those of us who identify as a specialized oncology nurse, and we have 39,000 members who do, I think what makes it unique in the world of nursing, and this hasn't changed since I became an oncology nurse in the 1970s, is the relationship with patients and their families, because we journey through that experience. Many other kinds of care in healthcare are episodic, and nurses may or may really not get to know the people for whom they're caring. But in oncology, you do, and there's a relationship that develops that is actually what our nurses tell us is rewarding. They hear so often, oh, isn't it depressing? And in fact, there are times it's very sad, and it can be depressing. But actually what you hear from somebody who is an oncology nurse is, no, it's rewarding. And you hear that over and over with generations of oncology nurses. So that relationship, that bond that forms with patients and families. And that forms because we spend, whether it's in the hospital or at a chairside, an infusion center, we spend more minutes or hours with the patient and family than any other of the health professions.
Yeah, we're going to talk a little bit more about that too. But Chad, I'd love to hear, you have a very unique story that brings you here today. Tell us a bit more about the Care+Wear story.
Sure. So we started the company 4.5 years ago, had friends and family diagnosed with cancer, getting treatment through what's called a PICC line, which goes in your arm, and told to wear tube socks on their arms. And so these really caring nurses were like, hey, instead of wearing the stretchy gauze that we give you, wear a sock. And so saw a bunch of loved ones wearing socks and thought there's got to be something better. And so started working with nurses and doctors from Johns Hopkins and UVA to redesign the tube sock. And as we're doing that, kind of took a step back and realized whenever you're in the hospital, everything you've been given is focused on function and not on how it looks or how it makes you feel. And we just felt there was an incredible need to build a brand in the healthcare space. And so today we partner with clinicians, patients, and designers to make each and every one of our products with the goal of kind of allowing you to try and live your life, or at least getting a smile on your face for at least 10 seconds.
Yeah. And now, Ruth, you are working in a unique cancer space. What really intrigued me was the stat that you said that nearly 80% of health outcomes are affected by the non-clinical setting. Tell us a little bit more about that and how the Ronald McDonald House helps families.
Sure. So we know that 80% of health and healing is really determined by the social determinants of health. That's education and transportation and all of those things that are non-clinical. And so the Ronald McDonald House is very much focused on that. We receive people from all over the country and all over the world who have gotten a diagnosis of cancer for their child and have arrived in New York City, often for the first time. Many have left families, loved ones, spouses, other siblings at home. And so our goal is to keep them together so that they can be close to the care team and close to each other. But the programming we do addresses those social determinants of health, from providing meals to providing the transportation to and from appointments, to bringing in educational programs for kids who need to be tutored or for their siblings who need to be tutored, so that those families can stay together and access, but also avail themselves to that life-saving treatment that is often found right here in New York City.
Yeah. And Brenda, I wanted to take a little bit back to what you were referencing about how oncology nursing is different from other fields, but really dig a little deeper into really the role of oncology nurses in caring for patients compared to the physician's role. Tell us a little bit more about what the actual nursing role is.
That's a great question, because I think until you need a nurse, you may not really know what the scope of what a nurse does. Obviously, there's the physical caring for patients, but a big part of what a nurse's world is about is assessing and critical thinking and teaching and hearing what patients and families are saying. And sometimes it is much easier for people to ask something of a nurse than it might be to a physician. So that relationship with nurses and doctors is very important, because oftentimes nurses hear things first when they're assessing a patient and seeing how things have been going in between treatments. They may be the first one to find out to the Ronald McDonald House resources are needed because they hear something from a parent, or they learn something from a person that says, you know, they're making decisions between can they pay their rent, or can they afford to come to wherever for treatment. And those are important things to know. We take that very seriously as nurses. The Gallup surveyors poll every year for the most trusted profession. And except for the year after September 11th, when firefighters were the most trusted, we've been the most trusted profession for the other 17 years. And we don't take that lightly.
So it's pretty clear that your relationship with patients really goes a good bit deeper and
Yes.
much more unique.
Yes. And that complements, you know, there's the clinical and the clinical expertise that's needed. But we like to say that nurses use their brain, their heart, and their hands, and often their backs.
Yes. Therein lies one of the problems for another day.
Well, that's another thing.
Chat, let's dig into your story a little bit more. You referenced some collaborations and partnerships that you have. I know that you have current ones with Oscar de la Renta, NBA. Tell us why those partnerships are so important to what you do.
Sure. So I'm a big sports fanatic. Grew up in Baltimore, and so for me, even though the Orioles sucked this year, really wanted to figure out how we could work with them. And we were really fortunate to get Major League Baseball to partner with us along with Stand Up to Cancer. And so if you buy a product that has a baseball team on it, instead of paying Major League Baseball a royalty, the royalty goes to Stand Up to Cancer. We did the same thing with the NBA, with the American Cancer Society. We actually yesterday launched a new NICU onesie with March of Dimes. And so we like to think of ourselves as a for-purpose company where we're always partnering with amazing foundations to help out in the community. I'm actually, first time in my life I get to be a model, I guess. I'm modeling a hoodie that was designed by Oscar de la Renta. So as many of you may or may not know, Oscar actually passed away from cancer a couple of years ago, and so it was very, very personal to them. And for us, we thought this is an incredible opportunity to partner with a great designer. And so this actually opens up, and you can. I'm wearing a T-shirt. Don't worry. Care+Wear branded, of course, but you can open it up and get access to your port, which goes in your chest. And you can play around with them outside as well. And then we actually got to teach a class at Parsons School of Design to redesign the patient gown. So everyone knows someone that's been in the hospital that has had their backside exposed. And as much as nurses and doctors love to see your backside, we thought maybe there's an opportunity to build something that wouldn't have your backside exposed. So worked with 11 amazing students, 9 hospital systems, then even had Donna, Karen, and Kay Unger come in and be a part of the class. and give their advice, and that is now available worldwide as well. And kind of going back to the idea of marrying something fun so patients can enjoy it, keeping them involved, having clinicians to make sure that we're fitting all the clinical needs, and then kind of thinking about fashion and making sure that these are products that are going to last for a long time is super important to us.
And let's turn our attention to the community for a minute. Ruth, you have amazing efforts around volunteering at your organization. Tell us a little bit more about that and like how you garner that effort in helping you forward your cause.
Sure. The Ronald McDonald House is on pace for about 8,000 volunteers next year, and we're close to that this year. The opportunity, first of all, it's children in cancer, so it appeals to people in terms of volunteerism. But secondly, we create all kinds of opportunities for people to help us. And so if you think about our facility on East 73rd Street, which houses 95 families, we can have up to 400 individuals in the house a night. And so serving meals to 400 individuals is one of the critical roles of our volunteer corps. And so we have teams, we have about 350 corporate teams that come in and provide days of service. They prepare and serve meals to our families. We have so many corporate volunteer teams that came in that we were able to establish a breakfast and lunch in addition to our dinner program. But in addition to those kinds of volunteer programs around food and meal preparation, we have teams that come in and will clean the house from top to bottom. We have schools that collect canned and boxed goods so that we have a fully equipped parents' pantry and families can take food anytime that they need to prepare meals themselves if they want to. And in addition to that, we have created opportunities for volunteers to do high-level service projects with us, whether it's strategic planning or branding or marketing, or we're hoping to bring in more folks who have language capability and cultural competency.
And Brenda, you know, we are in the midst of extremely complicated cancer advancements, wonderful advancements,
Yes.
but it's difficult really for patients to understand that.
Yes.
And I really consider one of the main roles of nursing is education. You know, limited time with the doctor, more time with the nurses, so it really falls on you a lot. How do you really help people understand everything that's going on now and their treatment options?
Well, we have to start with our nurses' understanding.
Yeah.
And with the really escalating number of agents getting approved and coming in to the clinical center, we've been, as an organization, and many other organizations are, really pushing a lot of education out for organizations to be able to use. Sometimes it's a just-in-time use. So it's important for us to develop resources for nurses, our own, but also some nurses in other settings like the emergency department, because sometimes patients do end up in the emergency department, to understand, particularly with immuno-oncology, what is happening. And just for like the ER nurses, it's the essential basics that they need to know. For ours, it's the deeper dive, and then how do we put that into language? It's the health literacy issue that as long as we continue to speak and try and teach from the cancer lingo, oftentimes that isn't understood. And I heard a nurse present recently. She draws a Gumby. Some of you may remember Gumby. And she draws a Gumby figure and gets very basic in terms of explaining things. And that's what we learn to do and learn to share best practices with each other for that.
Yeah, I mean, coming from WebMD, I can fully appreciate how you want to keep things nice and simple, but yet still educate.
That's correctly right.
You know, Chat, it seems like with what you do, you're really instilling creativity and imagination. Kind of sounds weird, but really even to the cancer journey. Tell us why that matters so much to someone going through that.
Yeah, I think it's kind of getting back to giving people hope and inspiring them to live their lives. I mean, 20 years ago, you'd be diagnosed with cancer and you would count down the number of years that you had left. And I think technology has evolved to the point where cancer is just I don't want to say another sickness or another disease, but you're able to survive, and the survivor stories are amazing, and just talking and speaking with our community is inspiring to us, and we want to help inspire them to get back to enjoying what they want to do and get back to being themselves. So, for example, with a PICC line, you are told you can go to work, you can go to school. We actually had a girl want to go to her senior prom and wanted to wear a sleeveless dress. And so she really wanted a PICC line cover that would match her dress. And we were able to get her a gray PICC line cover that, well, we call it slate. Actually, I should use the real terminology. My team will kill me if I don't. But that matched her slate-colored dress. And it was just so cool to get to have her email us and call us after and say, thank you so much. I was able to go to prom, sent us really cute pictures of her and her date. And just being able to put a smile on someone's face, because at the end of the day, everyone does know someone that is going through cancer and that has had it. And even, I've never personally had cancer myself, but seeing my loved ones fighting it and not knowing how I could help. I could get them flowers, which sadly will die at some point. I could get them chocolate, which they may or may not enjoy. But I couldn't do something to inspire that hope and confidence, and I didn't know what they were going through. And so being able to create a brand that is really focused on the patient and letting you kind of get back to being yourself is kind of our driving force and mission.
Yeah. If I may, to this point, hope and healing are not necessarily the same as cure. And that's a very important conversation that I think probably, you know, your volunteers and your staff have, certainly nurses do, and you may be doing the same thing. And I think that is important to recognize.
Totally.
Yeah, and I would add that, you know, one of the things we try to do is create memories, right? So most of the young people that come to us do thrive and survive. But that family's togetherness is about the memories they're creating along that journey. Right. And being together, they're creating memories as families. Right. So that's really important. It supports the dignity of those families and that health and healing journey.
So an audience, I'm going to toss out to you shortly, so get prepared with your questions, but I do have one final one. It's really about preserving patient dignity, because to me, that is really what all of you do. So I'd love to hear from each of you real quickly if you could just speak about like how important that is and kind of your role in preserving patient dignity.
Absolutely essential. I will never forget a situation, and some of you may have experienced this, where the healthcare team in a hospital setting just come in the door and don't knock. And I remember we had a sign on the door, please knock. The patient wanted a sign on the door. And when the physician team rounded, they didn't knock. And so she asked for a separate sign. And this means the physician team, too. That is important to respect the patient, to respect them in their space. Very important.
Yeah, I mean, I remember growing up as a kid, for better or worse, was in the hospital a lot, both as the son of a doctor and as a patient. And as a patient, I'd be running around in this gown, showing my backside and wondering why I'm wearing a dress. And so for me, that's kind of always been something that's like, why not? I mean, there's all these studies about the paint color in the hospital and how that impacts your care. Yeah. If that's going to impact your care, why isn't the product that you're wearing going to impact it as well?
Yeah, I would just add that, you know, if you can imagine arriving at Kennedy Airport with a sick child in your arm, first place you stop before you even get to the care team is the Ronald McDonald House. And you may have sold a business or lost a job, and you brought your child to the most life-saving treatment in the world. Most of our families come with no means, or very limited means. Right. And so that's who we're serving at the house. And that means that all of those other things that they need, having gotten their child here, need to be taken care of. And that's what we mean about meeting the social determinants of health, and really providing those families with the dignity around having those things that they're able to provide for their families.
Wonderful. Thank you so much. Let's see. Sorry. Okay.
Good morning. I'm Michael Burst. I'm the Executive Director for the Hematology Oncology Pharmacy Association. We partner with ONS and many other organizations to help deliver that care to the patient. And I just am so proud of the team that supports cancer care, and would just like for you to speak to the importance of having that input from multiple members of a healthcare team, because the complexity, as you spoke to, is so vast that in the past, where a physician might be the focal point, they can't possibly understand all the complexity of what that patient's going through now. And how do you coordinate that care in order for patients to have access to who they need to speak to about what?
Brenda, do you want to take that?
Well, yeah, I think you've captured it well.
Yeah.
There is a team. There has always been a team. I think probably if I go back to the earlier days, it was probably nurses and physicians. But we've seen the specialty, the clinical pharmacist with the specialization in oncology and hematology, the social workers, the same specialization, physical therapy. Some of you may not be aware in terms of cancer rehab, and also the professions, the healthcare professions, we've all developed this focus and this specialization. But my history in the clinical environment is it was always a team effort.
Wonderful.
Always.
Well, thank you so much. It's been a really inspiring conversation, and appreciate all the work that you guys do.
Thank you.
Thank you.
Thank you.